Over the past month, Guyana's vaccination figure has been rising, resulting in the rate of new COVID-19 infections, hospitalizations, and deaths plummeting. At present, there are 1,836 active COVID-19 cases, with just 58 of those persons requiring hospitalized care. However, while some regions, including Regions 1 and 4, are leading the country's vaccination campaign, other regions, like Regions 2, 8, and 10, continue to lag. To this end, it was revealed by Health Minister Dr. Frank Anthony during his daily COVID-19 update on Tuesday that if the residents of these regions continue to access the vaccine at a slow pace, the impact of the COVID-19 situation in those areas will be severe.
So the regions right now with the lowest vaccination rates would be Region 10, Region 8, and Region 2. These are regions with relatively low vaccination rate, both for first and second dose. We would therefore expect that at some point, when we get cases from these regions, we will probably see some of the more severe cases coming out that require hospitalization. And if people remain unvaccinated, some of them would die.
At present, 396,840 adults have received the first dose of a COVID-19 vaccine. This figure accounts for 77.4% of the eligible adult population. With regards to the second dose vaccination rate, some 271,204 adults have been doubly vaccinated, representing 52.9% of the eligible adult population. With regard to the vaccination campaign for adolescents ages 12 through 17, 28,769 persons have received a first dose of the Pfizer shot, whilst 19,946 are recipients of both shots. Meanwhile, persons above the age of 50 and frontline workers were also reminded that they are now required to access a third dose of a COVID-19 vaccine.
We are offering to our population here a booster dose for anybody above 50. And for those persons 18 years and older, if you are a frontline worker and you're at risk of getting COVID, then you can get a booster shot. Or if you have any comorbidities, then you can get a COVID shot. So I just want to appeal to persons, if you fall within these categories, come and make sure that you get your booster shots.
In September, a panel comprised of experts that were advising the U.S. Food and Drug Administration recommended that boosters be administered to people 65 years and over and other high-risk persons. Advocates of the booster point to data that shows that the vaccine's efficacy was waning after 6 months, and it was believed that a third dose improved the vaccine's effectiveness of immunity, especially against the fast-spreading Delta variant. However, during the time of that announcement, Minister Anthony was not in support of the booster shots, since it was stated that enough medical information was not available as solid proof to recommend that persons should receive a booster shot. For the HGP Nightly News, Kendall Richmond.